I see that one of the big questions on the internet is, what is a root canal? It's confusing to people. If you have ever seen a picture of a tooth and you see the structure of the root part of the tooth, the root form, you can see usually there's 3 or 4 roots. The crown attached, the crown part's in your mouth. And the roots have inside of them hollow spaces, hollow canals. And these hollow canals converge in another space called a pulp chamber. Nerves and blood supply of the tooth bundle through the internal part of that tooth, the pulp chamber and the root canal system. And this is where, when bacteria enter into the space, and they do so mainly through tooth decay or through a crack in a tooth that creates a crevice so that bacteria can travel via saliva into the tooth structure and then into the root canal space. Those are the 2 most common routes. Once the bacteria enter into the system, you then have what's called the root canal infection. This can then present with symptoms. Sometimes it does and sometimes it doesn't. The usual symptoms that present first will be something like a cold sensitivity that develops, a sensitivity to biting or chewing, and eventually you can develop a throbbing sensation in the tooth, and you can also develop a triggering of the pain traveling up to the ear area. Sometimes you can feel it starts on the bottom of the jaw and then it travels up to the top. We call that referred pain. And so the bottom line is, once bacteria enter into this root canal space, we then need to perform a procedure called a root canal. What are the things to look out for? What are the pitfalls? What are the danger zones in terms of getting a root canal done by anyone, or particularly someone who has very specific training in this area? They'll make an access through the crown of the tooth, that's the part of the tooth that's exposed to your mouth that you chew on, the part of the tooth you can touch with your tongue. They'll make an access through that area into the root canal space and begin to remove the tissue and the infection from the root canal system. And then we move on to restoring the tooth. Once all these bacterial elements are removed and the root canal system has been treated in its entirety, in other words, no bacterial infections been left behind, no tissues been left behind in the main canals or in accessory canals or in what we call lateral canals. Once that's achieved, the tooth has the capability of healing. And we'll talk further, and we're going to address subjects of the risk of root canal treatment in the general health. We'll be addressing that in the future. There's been people that tout not doing root canals at all, extracting teeth, removing them. We're going to deal with all these subjects in multiple videos as we move forward on this project of exposing the general public and populace to what it is a root canal is and all the intricacies that relate to this subject. Thank you.